Hi, hello, this is me Ajay Sudev from Radio Olive, and I'm going to have an insightful conversation about antenatal care. And we have with us Dr. Vijayalakshmi, Specialist Gynecology,
Hello.
and Dr. Lufna, Specialist Gynecology from Reyada Medical Center. So, Doctor, I have a question. Could you briefly explain what exactly is antenatal care and why is it important for expecting mothers?
Yes, the term antenatal care includes the care of pregnant women from the start of the pregnancy until the end of it. So it also includes the period before the pregnancy and 6 weeks after the delivery process.
Okay.
What does this care include? It is a package of the blood test and the antenatal visits along with the scans. And it is really important that the patient comes each and every visit regular so that we try to catch up the complications a little early,
Okay.
like a low hemoglobin or high sugars
Okay.
or high BP, and we can treat them further.
Okay.
And all this helps in the process of getting a healthy baby.
Healthy baby. So, doctor, what are the key checkups and tests done during the antenatal visits?
So the test during antenatal visit can be divided into either blood investigation or the scanning. So when you come to the blood investigation at the first visit or once the pregnancy has been confirmed, we just wanted to know the general health of the mother, which has got a great implication on the pregnancy, both in positive and also in negative way. So it includes all the basic blood tests like the hemoglobin and also the sugar status as well as the thyroid status and also some like viral screening, the blood group of also and also like urine analysis. And also then actually like every 3 months we usually ask them to repeat the hemoglobin and also the thyroid and as well as the urine, because as the pregnancy advances the requirement for all these nutrients will increase. So there may be like some changes we may notice like as the pregnancy advances. And particularly like between 24 and 28 weeks, we do the screening for the diabetes in pregnancy, because at that time the insulin requirement is is the highest, and that time maybe the patient first get recognized with the diabetes in pregnancy. So when we come to the scanning, if it is an uncomplicated pregnancy, there is like a basic 5 scans we recommend. The first is a dating scan to know about the date of the pregnancy and also to know about the healthy baby or the healthy status or the cardiac activity between 7 and 9 weeks. And next is a NT scan, which is done for ruling out the genetic anomalies between 12 and 14. And then the anomaly scan, which is a detailed scan to know every organ of the baby between 20 and 22. And a general growth scan at 30-32 and a term scan to know about the weight of the baby, presentation, the placental location, just like after 37 weeks.
Nowadays, things are changing.
Yes.
People are getting more and more aware about antenatal care. But still, a major chunk of people are still not aware of it, and
Yes.
they are neglecting this thing. What might be the reason?
As you said, it's right, but most of the people, they are coming for the regular care. We have observed certain set of people who don't come. They may come in the 5th or the 6th month of the pregnancy. So they would have given birth to children already, like 4 or 5 children are already there and they have had the experience of it. So they just start taking the medicines and they think it's okay if we do 1 or 2 scans in a while and go for checkup or the delivery at the end. But the issue is, as the pregnancy is advanced, the risk is higher and the chances for complications like anemia or sugars is more. So we need to do regular checkup so that we pick up these complications a little early and we can help them to have a smooth delivery.
Okay. Yeah. And what are the role of vaccinations and why are they important for both mother and the child?
So like when we come to the vaccination, two commonly or the two basic vaccination which is usually recommended in pregnancy is the flu vaccine and also the Tdap vaccine. For flu, as we all know, like it's very common nowadays, but when it comes in pregnancy, it's like a little different entity. When it is complicated, it may lead to like severe end, and also for the completion of the treatment or for making ease of the ventilation and all like ICU procedure, we may need to actually deliver the baby early, which may result in a preterm birth and the associated complications for the baby, prolonged NICU admission and all. And next is the Tdap vaccine, which is done at 28 weeks. This is like to vaccinate against 3 deadly diseases, that is actually the tetanus and also the diphtheria and pertussis. And this is mainly to prevent, like, more than for the mother, it's like for the baby, because after delivery, like, to prevent the neonatal tetanus and also like to the respiratory infections and all that are common in like newborn babies can be actually prevented to some extent if you do this vaccine properly.
Thank you so much to both of you, because you took out your time and had this conversation about antenatal care, which is really important. And to be honest, for me, this was a new term for me, and I also got to know a little bit. And this is for the expecting mothers. If you're thinking whether to go or not to go for the checkups, this is your call. Make up your mind and visit Reyada Medical Center.